Hi, I'm Lindsay Fluke, and my research project was increasing attention using inflatable seating in a preschool age child. Previous research suggests that using an inflatable cushion as a form of alternative seating is effective in increasing attention in preschool circle time. When going about my research project, my question was, will inflatable seating increase attention in whole group instruction in a preschool age child? The child observed was in a preschool at Westdale Heights Academic Magnet and was 52 months of age at the time of observation. The child was screened using Ages and Stages and TS Gold and had no underlying behavior problems or IEPs. My definition of behavior was defined in the Early Childhood Education Journal as curiosity, interest, optimism, and passion that students show when they are learning or being taught. The baseline data was collected over a 5-day period in 10-minute increments. After the first 5 baseline observations, the inflatable cushion was introduced and 5 more 10-minute observations were recorded. The observer sat in the front corner of the room to avoid distracting students, but in the front so that they could see the students' faces. Before the introduction of intervention, the teacher had to consistently stop during the whole group instruction and give verbal correction to students not paying attention. This was distracting for the teacher and the other students and also took much time away from instruction. The inflatable cushion was given to the child every day in whole group instruction in hopes of increasing his attention and decreasing the amount of times the teacher had to stop instruction. When introduced, the child was first distracted by the inflatable cushion. However, it is assumed that with more time, the inflatable cushion will become less of a distraction and more of a routine. The research suggests that with time and persistence, an alternative inflatable seating option would increase attention in whole group instruction. Baseline data shows that the child's attention ranged from 20% to 50%, with an average of 36%. When the intervention was put in place, the child's attention ranged from 30% to 80%, with an average of 48%. Sessions 8 through 10 are assumed percentages due to complications with coronavirus. It has come to conclusion that teachers could use this inflatable seating intervention to slightly increase attention in children during whole group instruction. Future research could determine better forms of alternative seating or whether or not it should be introduced in all forms of instruction.